Hi everyone, my name is Samantha. I'm a pharmacy student here on rotation. I'm on my 4th year and I'm on rotation here at BPC. So today I just wanted to talk to you all about hypertension, otherwise known as high blood pressure. So our objectives today are to go over in more depth what is hypertension, what are the risk factors for high blood pressure, how is blood pressure measured, how can I prevent or manage high blood pressure, what different medications can treat hypertension, and what are the common side effects to hypertension medications. So hypertension, the definition again, high blood pressure. High blood pressure is a common condition that affects the body's arteries. The force of blood pushing against the artery walls when the heart pumps becomes consistently too high, and the heart must work harder to pump the blood. So a quick fast fact here, according to the CDC, a greater percentage of men have high blood pressure compared to women. Also, nearly half of adults in the US have hypertension. And around 1 in 4 adults, interestingly, actually have high blood pressure under control if they have the disease. So some risk factors that can put you at increased risk of developing high blood pressure include obesity, a sedentary lifestyle, meaning you don't really move around too much, excessive salt intake in your diet, smoking, family history of high blood pressure, diabetes, and high cholesterol. There are some dangers of uncontrolled hypertension, meaning you have hypertension but it's not treated. These include heart attack and heart disease. This happens because damage can occur to your arteries over time from high blood pressure, causing them to become less elastic and more stiff. This causes a decrease of blood flow and oxygen to the heart muscle, causing a heart attack to occur. Stroke can also occur, which is when high pressure in the arteries supplying blood to the brain actually causes the arteries to burst, causing a life-threatening stroke. And of course, kidney disease. This is a chronic constriction, a narrowing of blood vessels, and creates weakness and damages. As the vessels flowing to the kidneys become more weakened, the kidneys can no longer get adequate blood flow, causing kidney disease. So, how do we measure blood pressure? First, an inflatable cuff is wrapped around your arm by a healthcare professional. The cuff is inflated and becomes tightened around the arm. It shouldn't hurt, but it is sometimes uncomfortable. And the cuff has a gauge in order to measure the pressure of blood moving through the arm. Then air is slowly removed from the cuff while a healthcare professional listens to your pulse. And the gauge on the cuff measures the pressure in something called millimeters of mercury. So what do these numbers mean? A blood pressure reading will provide both a systolic, or the top number, and a diastolic, the bottom number, on the blood pressure measurement. So systolic blood pressure is reflecting the force produced by the heart when it pumps blood out to the body, while the diastolic blood pressure is the pressure in the blood vessels when the heart is at rest and refilling. So let's watch a quick video on how to properly take a blood pressure measurement, especially if you're going to be managing your blood pressure at home with an at-home blood pressure cuff.
To get an accurate reading, it's important to take your blood pressure correctly. One of the most important factors in taking accurate blood pressure is having a proper fitting cuff. Once you have the right cuff size, find a quiet environment and rest for 15 minutes. Sit in a chair with your feet flat on the floor and your back straight. Rest your arm on the table with your palm facing upward. The cuff should be level with your heart. Do not talk or move while taking a measurement. Avoid food, alcohol, exercise, smoking, and bathing for 30 minutes prior to taking a measurement. Your blood pressure can naturally fluctuate throughout the day, so taking it at the same time each day will give you more accurate comparisons. For tips on making changes to your lifestyle to lower your blood pressure, visit omronhealthcare.com.
That was a helpful video just showing how you would take your own blood pressure measurements at home with an at-home cuff, but The rules still apply for if you're getting a healthcare professional take your blood pressure with your feet on the floor, having the cuff at chest level, so it's a very helpful video. It's just a reminder. So there are 4 categories of blood pressure. Normal blood pressure is that top number, the systolic blood pressure, being less than 120, and the bottom number, or the diastolic blood pressure, being less than 80. Stage 1 hypertension is indicated with a top number between 130 to 139 and a bottom number between 80 to 90. And then stage 2 is when the top number is greater than 140 and the bottom number is greater than 90. And I missed one. The elevated blood pressure is a little bit higher than normal, but not quite yet at a stage 1. And that's when your top number is between 120 to 129 and the bottom number is less than 80. So what are some things that can affect a blood pressure reading? So nervousness is a big thing that can affect your blood pressure. Sometimes when we're in a doctor's office, we might feel a little bit nervous, causing our blood pressure to be a little bit higher. Feeling anxious or nervous during a blood pressure reading can actually cause a higher than normal blood pressure, even if you don't have high blood pressure. How you're sitting during the reading is very important. Like that video showed, you want to have your feet flat on the ground and not crossed, and the band itself should be at chest height, or else it could increase your blood pressure or give an inaccurate reading. What you ate or drank before the reading is also very important. The video talked about avoiding smoking, drinking caffeine or alcohol at least 30 minutes before your reading, because all of these things can increase your blood pressure and give you an inaccurate reading. So in order to prevent and manage high blood pressure, there's some things that you definitely want to do, and then there's some things that you don't want to do. So let's go over the right things to do first. You definitely want to try to get at least 150 minutes of exercise each week. Eating a healthy diet with lots of fruits and vegetables is important as well. There's a diet called DASH diet. This is specific for heart health. This includes a diet high in fruits, vegetables, fiber, and low-fat dairy products. It's also very important to maintain a healthy weight, as well as manage stress. Some things that you want to avoid doing in order to prevent or manage high blood pressure is to smoke, drink alcohol, and eat large amounts of salt in your diet. Eating lots of sugar and saturated fats is also something to try to avoid. So let's go into some of the classes of blood pressure medications. Some of you might be familiar with some of these. These are the first-line agents for blood pressure according to the American Heart Association. The 4 first-class agents are angiotensin-converting enzyme inhibitors, otherwise known as ACE inhibitors, the dihydropyridine calcium channel blockers, angiotensin receptor blockers, which is also known as ARBs, and thiazide diuretics. So ACE inhibitors are medications used to help relax veins and arteries in order to lower the pressure. ACE inhibitors prevent an enzyme in the body from making angiotensin II. This substance narrows blood vessels, so by inhibiting angiotensin II, the blood vessels can relax and avoid being constricted, which would raise blood pressure. Some of the common ACE inhibitor medications end in PRIL, pril. Benazepril, enalapril, lisinopril, quinapril, ramipril, and captopril. A quick fun fact about ACE inhibitors is that they can cause some patients to develop a dry cough. If this happens, switching to a different agent, such as an ARB, which is a medication we're going to talk about next, is likely to decrease this side effect. So going into the ARB medications, they work very similarly to what we just talked about, the ACE inhibitors. These medications work by blocking the hormone angiotensin from binding to receptors in the heart, blood vessels, and kidneys. Once again, blocking angiotensin II from working in the body results in lowered blood pressure and prevention of damage to both the heart and the kidneys. These medications commonly end in sartan, irbesartan, losartan, olmesartan, valsartan, candesartan, and telmisartan. A quick fact about ARBs is that they cannot be used along with an ACE inhibitor because they have such a similar mechanism of action. So you would never take both an ACE inhibitor with an ARB medication. Next, we're on to calcium channel blockers. These medications block calcium in the body from entering the cells of the heart and the arteries. Calcium causes the heart and arteries to squeeze more, which as a result will increase blood pressure. By blocking calcium, blood vessels can relax and squeeze less to lower blood pressure. Some common calcium channel blockers all end in the words P-I-N-E. Amlodipine, nicardipine, nifedipine, and felodipine. Fast fact about calcium channel blockers is that they can potentially cause something called peripheral edema. This causes swelling in the legs, ankles, feet, and sometimes the arms and hands from the retention of fluids. If you're taking a calcium channel blocker and you notice any of this swelling, it's something that you want to let your doctor know about as soon as you can. Next up, we have the thiazide diuretics. Diuretic medications work by blocking sodium and chloride channels in the kidney in order to block the reabsorption of salt and water into the body. By removing sodium through the urine, water will follow, causing less fluid buildup in the body. When there's less fluid in the body, that's the less that the heart has to push against, causing your blood pressure to be lower. Some common thiazide diuretics that you may have heard of are chlorthalidone, hydrochlorothiazide, and metolazone. These medications that may be used with other over-the-counter medications need to be used with caution. So medications such as ibuprofen, which can be purchased over the counter, can cause sodium and water retention. This is the opposite of how thiazide diuretics work. They work by getting rid of sodium and water to create less fluid in the body. Therefore, whenever you're taking a medication and you want to try a new medication like ibuprofen that's available over the counter, you should always talk to your doctor or pharmacist first because it could potentially decrease the effectiveness of the medication that you're taking. So NSAID medications such as ibuprofen should not be used if you have high blood pressure. Next, we're going to talk about beta blockers. Although they aren't often used to treat high blood pressure and aren't one of the first line agents, they can sometimes be helpful to treat high blood pressure and heart rhythm disorders. They block both adrenaline and noradrenaline, which are stress hormones. By blocking these stress hormones, it slows the heart rate, which reduces the force of blood being pumped around the body, overall lowering the body's blood pressure. Some common beta blockers end in OLOL, atenolol, metoprolol, both tartrate and succinate, bisoprolol, and acebutolol. Beta blockers should be used cautiously in patients that have diabetes because they can mask the symptoms of high or low blood sugar, making diabetes difficult to manage. Some of the most common blood pressure side effects are dizziness, drowsiness, nausea, lack of energy, headache, and that dry cough that ACE inhibitors can sometimes cause. In order to manage these side effects, such as drowsiness and dizziness, you should be aware that they should usually go away in about 2 weeks while the body gets adjusted to living at a lower blood pressure. Increased blood pressure is not really something that we can feel, so it's really hard to tell if the medication is working. But regular monitoring of blood pressure using a cuff can confirm if the medication is working or if an additional medication may be needed or a higher dose of medication is indicated. Once again, there are some common over-the-counter medications available to us that you may need to avoid if you have high blood pressure. For instance, decongestants, such as Sudafed-containing products, can narrow blood vessels, making it harder for blood to flow through them. This increases blood pressure as a result. Pain medications, like I had talked about before, such as NSAIDs, like ibuprofen and naproxen, which are Advil and Aleve, can affect the kidneys by reducing blood flow to the organ, which causes sodium retention. Sodium retention leads to water retention, and that will cause blood pressure to rise. So once again, anytime you're thinking about purchasing an over-the-counter medication or starting a new medication, you should always talk to your doctor or pharmacist to make sure it's safe for you given your current condition and other medications you take. Okay, so we have a little bit of a recap. These are 2 great videos from the CDC that really go in depth and just give us a nice little refresh on everything we've talked about so far today.
It's a beautiful fall evening. The sun is setting. The dog finally stopped barking. Life is good. But inside, there's trouble brewing, and Emma has no idea. Although she feels fine, like her father, Emma is one of the 67 million adults in the U.S. with high blood pressure, or hypertension. Just like her radiator that's on the fritz, Emma's heart is working overtime to get the job done. Let's have a look. The heart is the pump in our bodies, delivering blood to the entire system through a set of pipes, or blood vessels of all sizes. Smoking, high cholesterol, diabetes, obesity, physical inactivity, family history, and increased age all contribute to these blood vessels, or our pipes, becoming less elastic. The more blood our heart has to pump through stiff, narrowing arteries, the higher our blood pressure. When the force of the blood against our artery walls is too high, life-threatening health problems can result. Problems like kidney disease, heart disease, stroke, even heart attack. Can Emma get her pressure down before it's too late? Like millions of Americans, Emma was living with high blood pressure and didn't know it. There were no early warning signs or symptoms. But Emma's heart was working overtime, putting her at risk for heart disease and stroke. Following a physical, Emma was diagnosed with high blood pressure, also called hypertension.
People of all backgrounds can develop high blood pressure. Treatments differ based on risk factors including age and family history. But hypertension can often be controlled with healthy habits and medication when necessary. Eating more fruits and vegetables, following a low-salt diet, exercising regularly, and quitting smoking are often the first lines of defense to control high blood pressure. Your doctor may prescribe 1 or more medications to help lower your blood pressure to normal. Some rid the body of extra sodium and water. Others reduce the heart rate or relax the blood vessels. Always take medications exactly as prescribed and don't skip doses. While medications can effectively lower blood pressure when taken correctly, each type has potential side effects for some people. You might feel tired or have trouble sleeping. You may experience a dry cough, stuffy nose, leg cramps, frequent urination, or headaches. If you have side effects that don't go away with time, don't just quit taking your medication. Talk with your doctor and pharmacist, as there may be other medications or different doses that can control your blood pressure and have fewer or no side effects. Focus on the benefits. Taking your medication regularly will lower high blood pressure and protect your brain, heart, and kidneys from life-threatening consequences like stroke or heart attack, often the first scary signs of hypertension when left untreated. Control your blood pressure and reduce your risk by knowing your goal numbers
and monitoring your blood pressure at home or at your local pharmacy in between doctor's visits.
How's Franny?
She just graduated from obedience school.
Pharmacists play a key role in working with your physician to improve blood pressure management. We can address medication concerns and challenges. So talk to us about your treatments and goals outlined by your doctor. If taking your medication feels like a chore, don't just stop taking it. We can counsel you on working through side effects or determine when you need to see your doctor about possible changes in your medications. And we'll share healthy lifestyle tips to keep you on track. Whether you monitor your blood pressure at home or in the pharmacy, we're here to discuss your numbers and provide guidance. Okay, Emma, you're all set. I'll see you back here soon. Visit millionhearts.hhs.gov to team up with your pharmacist to bring your blood pressure down.
I really like those videos. It's a great recap of everything we've talked about. Okay, so just to wrap everything up, we're just going to finish with a few questions here to see how much you remembered from the videos. So, which of the following is not a risk factor for developing hypertension? Is it A, smoking, B, eating a lot of salt, C, running for 30 minutes every other day, or D, drinking 3 alcoholic beverages most days? So the answer is C, running for 30 minutes every other day. Exercise is a great way to not develop high blood pressure over time. It's very good for your heart and it can keep you from getting high blood pressure in the long run. So which of the following is not a first-line drug class used to treat hypertension according to the American Heart Association? Is it A, vasodilators, B, ACE inhibitors, C, ARBs, or D, calcium channel blockers? So the answer is going to be A. Vasodilators are not one of the first-line drug classes. The other 3 are first-line, in addition to thiazide diuretics. Okay, so which of the following measurements is considered a normal blood pressure? Is it A, 160 over 90, B, 115 over 78, C, 129 over 80, or D, 130 over 85? So the correct answer is going to be B, 115 over 78. This is a normal blood pressure and something that we want to have because it's below 120 over 80. If we look at A, 160 over 90, that person would be stage 2 hypertension. Choice C, 129 over 80, means that they have elevated blood pressure but aren't quite yet at stage 1 hypertension. And D is a good example of stage 1 hypertension. Which of the following foods are part of the DASH diet? Is it A, fruits, B, vegetables, C, low-fat dairy products, or D, all of the above? This one is all of the above. Once again, that DASH diet is really great. It's a diet that includes fruits, vegetables, low-fat dairy products, and fiber, and it's very heart healthy. Next question is, which of the following medications is an ACE inhibitor? Is it A, aspirin, B, lisinopril, C, metoprolol, or D, irbesartan? So the answer is B, lisinopril. ACE inhibitor medications commonly end in pril, P-R-I-L. That's a good way to remember that medication class. Next question is, which of the following is not a common side effect of blood pressure medications? Is it dizziness, B, headache, C, sore muscles, or D, lack of energy? So typically, sore muscles will not be a common side effect of blood pressure medications. While in the first 2 weeks while you're getting adjusted to the new medication, dizziness and tiredness are definitely a possible side effect, but sore muscles not so much. All right, everyone, thank you so much for listening to my presentation. The pharmacist should be in very soon to go over any questions that you may have, and I hope everyone has a great day.